let's talk about that one big, beautiful bill and what it means for Medicare. Because there's a lot of noise out there, and I'm here to set the record straight with the facts that are in this bill to make sure we strengthen our country and protect our seniors and ensure Medicare is there for those who need it the most. Okay, so one, the big, beautiful bill does not cut Medicare benefits. Not one single dime is taken from the benefits that our seniors rely on. Claims that this bill guts Medicare are pure fear-mongering. Now, there are some changes, and they're about making Medicare smarter and stronger. The big move is cracking down on waste, fraud, and abuse. They are allocating $25 million to use cutting-edge AI to sniff out improper Medicare payments, overpayments that cost taxpayers billions of dollars every year. The Department of Health and Human Services are going to work with the data scientists to recover those funds, and they'll report directly to Congress on the process. This isn't about cutting care. Another change. They're tightening the eligibility to ensure Medicare goes to those it's meant for. Right now, some lawfully present immigrants, like those with temporary protected status, refugees, asylees, can qualify for Medicare if they've worked and paid taxes long enough. The bill adjusts this, limiting eligibility to permanent legal residents with green cards or specific groups like those from Micronesia and the Marshall Islands, or Cuba in certain cases. This could affect some folks who've been getting benefits and they've had a year to make this transition, so this is not new to them. It's a tough call, but it's about focusing resources directly on the citizens of the United States and long-term residents who built their lives here. Here's a big one. The bill delays some Biden-era rules that were set to streamline enrollment in Medicare savings programs that help the low-income seniors cover their premiums and copays. These rules won't kick in until 2035, which can mean up to 1.3 million dual-eligible folks. People on both Medicare and Medicaid might face higher out-of-pocket costs, like about $4,440 a year for premiums or $1,676 hospital deductibles. Oh, and about these automatic cuts you might hear about from the left, some say the bill's tax cut could trigger a $500 billion cut to Medicare over the 8 years because of deficit rules. That's speculative. It depends on how the budget shakes out and whether Congress acts to waive those types of triggers, which they've done many times before. The bill also boosts Medicare in smart ways. It expands a rural emergency hospital program. This is a big one. Given the struggling hospitals in rural areas in our country, and it bumps up physicians' payments by 2% in 2026. Tying future increases to inflation so doctors can keep their doors open for Medicare folks. That's a huge win for access care. So here's the bottom line. The one big beautiful bill safeguards Medicare for our seniors, cuts waste, tightens eligibility, and invests in rural care. It's not perfect. Some folks might face higher costs, and we're going to keep an eye on that, but it's about making Medicare sustainable for the 68.5 million Americans who rely on it. I hope you got the facts.